the acupuncturist in the Bayville office of Thompson Healthcare and Sports Medicine. Today I'm here to talk to you about auricular medicine. Auricular medicine is another modality that acupuncturists use to help diagnose and treat their patients. Now, there are two main branches of auricular medicine. One is a Chinese method and the other one is a European method. I personally use the Chinese method prescribed by Dr. Huang, who I believe actually shown that it was more clinically effective. Now, there's multiple viewpoints on how auricular medicine works. One of them is a holographic representation of the human body, whereby it's a mini microsystem of the ear correlates with different sections of the human body itself. One other theory is how acupuncture meridians and channels indirectly or directly innervate into the ear itself, giving you access to the major organs. Lastly, there's a brain proximity theory whereby because the ears are so close to the brain, you can elicit treatment responses because the ears are innervated and with myriads of nerve endings. Primarily, I look at the holographic representation because it's easier to remember and easy to clinically see. Well, what I mean by that is if you take a look at my ear, what I look for is a picture of an inverted fetus. So the head down here, the extremities go all the way coming down here, and this is the particular spinal tract, with this section being the upper extremity and these being the lower. The internal areas of the concha are more the internal organs. So next I'll show you how I demonstrate on a patient what I look for in order to diagnose and guide my treatments. So for the next section, I want to demonstrate how I actually use the auricular medicine to guide my diagnosis and treatment. Patient Kim here kindly volunteered to show us her ear, and I'm going to go through the process of what I look for. So if you take a look at the ear, what I first look for is the overall structure of the ear to make sure that it is nice and pink, it's the right size, there's no differentiating marks or deformities or changes in color. So initially, since we are an orthopedic clinic, I focused a lot more on the spinal tract, which is this section here. So I'm looking for right now are discoloration. I'm seeing are these little pink and red striations. They usually indicate an acute inflammation. So a lot of times when I see this, I focus on these particular areas. So this is more along the lumbar region of her body, so she potentially have lower back pain. Other areas I look for, like the digestive tracts, I'm seeing slight pinkish here, maybe a little spot there, indicating issues with digestion overall. Further up, potentially she could be having issues with her lower leg and limbs. And this little spot there is representative of something called Shen Men. It's an acupuncture point for it's a calming point, but it's usually associated with anxiety. And this last part, what I'm going to show in terms of auricular medicine is the treatment phase. So based on the findings and the striations I was looking for, what I'm going to do initially is apply an acupuncture needle to those areas. Now, once I apply the acupuncture needle, you could leave it in for 15 to 30 minutes as a standalone treatment, or you could use it as an adjunctive therapy with other acupuncture body points. So really clean the ear, just keep it sterile. And I'm going to put one here. I used Japanese needles with a guide tube to kind of act as to kind of distract and reduce the pain that a patient may feel. And that's with an acupuncture needle. Next one I'm going to show you is an acupuncture seed, an ear seed. These are Auricular seeds with a bandage, and they are for longer term treatments. You can keep these on for 2 to 3 days depending on the weather. These days, because it's getting warmer, 2 to 3 days. Winter times can go for about a week. So I can apply these on these little areas. And leave them in. Let's move this one. So once these ear seeds are in, tell your patient to let them know if they have any adverse reactions of allergies or itchiness or pain from the actual seed to take it off immediately. Otherwise, they can keep it in. They can shower with it, and if they feel it's uncomfortable, they can take it off in the 2 or 3 days. So thank you for joining. I'll see you next time.